COO female who was referred to us in August 2018. Okay, so what actually happened was she was referred as a case of SLE with hematological manifestations. Okay, so the reason for referral was she had difficult lupus, which was resistant to treatment, and how she presented to a different hospital was she was well previously, and she presented with oral ulcers, leukopenia, and she had leukopenia, she was anemic, and her ENA was positive, and she was diagnosed as SLE. Okay. So what happened was when she presented to a different hospital, these were her symptoms. She was well previously. And along the way in 2000, okay, maybe before we go on to the progress of her clinical scenario, maybe we want to ask ourselves, what are the features of clinical presentations that may suggest lupus in her? Is she in the correct gender? Yes, she's a female. Okay. And is she the age of onset of her illness? Yes, she's 40. She's in the reproductive age group yet still. She had oral ulcers. So what our answer would be, she has all of the above. Yeah. And if we look at the some characteristics, and this has been the same even from before. The ratio of a female getting lupus compared to a male is 9:1. And this has never changed. And this is something that we can't change as well. We are born as a female or a male, yeah? And the ratio peaks in the reproductive age group, and that's the onset of the disease. Okay. So does she have diagnosis of lupus? Or not sure if lupus. So how do we go about? So what we do here is we go through the diagnostic criteria. This is the ACR 1997, but this was a bit delayed, a bit long time ago. Yeah, but we'll just go through because some people are more familiar with this. But what is something we may say that the sensitivity is only 82.8% and the specificity is quite good. If according to this criteria, whereby you have to have about 4 out of 11 criteria for you to be diagnosed, yes, she had oral ulcers, she had hematological manifestations like anemia, leukopenia, her ANA was positive. Yes, she does fulfill the criteria. But what about the latest criteria that we have, which is the SLE criteria? And in this, the newer version of a SLE criteria, you have we have actually 10 domains, 7 clinicals, and 3 laboratory. And this one has got a higher sensitivity of 94% and a specificity of 92%. And again, if we were to look at her presentation and whether she fulfills, yes, to an extent, she does fulfill the criteria. So she was labeled as a SLE with mainly hematological manifestations. So her journey throughout 2018 wasn't that happy journey. Okay? She had multiple admissions to the hospital, which was she presented to initially January, June, August. And all was for hematological flare. She presents with a low hemoglobin and she had to be given steroids. She has to be started on oral PrEP. She was started on hydroxychloroquine. And after the subsequent admissions, she was started on MMF. Hence, the outcome of her treatment wasn't that satisfactory. So she was referred to us in August 2018 with a possibility of frequent and resistant hematological flare. Okay. Into the history, she didn't have anything extra that we got besides what she presented with initially to the other hospitals. And clinically, she was pale. But apart from that, her vital signs were stable. She didn't have any cutaneous manifestations, no lymphadenopathy. She didn't have any hepatosplenomegaly, lungs, CVS were all clear. Here comes her investigations. Okay. Her hemoglobin was 3. So we do not know what was the hemoglobin when she was discharged. So she easily drops her hemoglobin. She was pancytopenic with neutropenia and lymphopenia. Her rectal count was only 0.3%. Bilirubin was not elevated. Direct Coombs was negative. Her LDH was elevated. And urgent full blood picture showed she's got severe anemia to exclude acute blood loss or hemolysis. So when we look at the clinical and laboratory manifestations of patients with lupus, patients have positive NA, almost 97% of patients. And the other characters that the patient had, leukopenia, 46%, anemia, 42%, and a positive ANA. So we were saying that, yeah, she looks like she has the features, but why is she not responding to the treatment? Okay, her hemoglobin was 3, if we could recall. She was given blood, she was given steroids, hydrocortisone, followed by metaprep. Okay, if we could recall, she was given pulse a few times. So there's always a concern of infection in these patients. So whenever we want to pulse our patients, we have to make sure there is no onboard sepsis. So the septic workout was negative, after which she was given pulse. She was even given IVIG. Again, unfortunately, we didn't see any response in her. So, okay, her thyroid function was normal, her B12, folate, everything was normal. We have repeated the immunology, we were still pending then. Urgent bone marrow was done, bone marrow with a trephine was done. So here comes the question, are we missing something in this patient who was 40 years old, presented with symptoms suggestive of lupus, ANA was positive at the onset of presentation. So, yeah, wadu, are we missing something? So what are the differentials that we want to consider in her? So if we look at the differential diagnosis of lupus, under the autoimmune disease, she may have lots of things, yeah? But if it's another autoimmune rather than a lupus, she should have responded to all the immunosuppressive therapies, which she is not responding. Okay, infection is something that we have mentioned earlier, but TB, not only pulmonary TB or extrapulmonary, but especially TB marrow is something that we will always have in mind whether this patient has TB marrow. Okay. Fibromyalgia, I'll be happy if she has fibromyalgia because nothing to worry about, but the fibromyalgia doesn't give you this kind of a hematological manifestation. Allergies is too long for her allergies. Okay, neurological disorders, somehow she doesn't have any of the symptoms. Malignancy, are we dealing with hematological malignancy in her that we are not seeing a response in her? Okay. Drug-induced lupus, we cannot forget that history. Okay, this one, we went into the details. She denied any form of treatment, any form of drug therapy. So again, it doesn't look like it's supportive of a drug-induced lupus. Psychiatric disorders, again, she was well to start with. Okay, so the results of her immunology came back. Her ANA and double-stranded DNAs were negative. Okay, look, so this is a patient who initially came in with symptoms. ANA was positive then, but now it is negative. And finally, her BMA results came. The bone marrow, which showed presence of 20% blast with background of left shift maturation, and the impression was acute myeloid leukemia. It was AML. The difficulty in her was she was given lots of treatment. She was, at one point in time, her total white was very low. She had to be given a GCSF. Okay, all those things actually interfered with the marrow reading. But somehow they managed, our colleagues, our hematologists were very helpful. They managed to give us, the impression was the AML, and she was transferred to the Ampang Hospital. So in summary, this is a young female presented with symptoms suggestive of lupus. Initially, ANAs was positive, but she was resistant to treatment. So she actually had a hematological malignancy, and SLE was mimicking her symptoms. Okay. Okay, now we will go on to the second case, which is, okay, this was actually the referral letter, and this is a patient that I saw 2 months ago in the clinic.